Hi, so I'm Alex Chediak. I am currently at the University of Miami, where I pretty much started my career. And I got into sleep medicine as a result of inspiration by Marvin Sackner and Martin Cohn, who were back then the chair of medicine at Mount Sinai Miami Beach and the director and chief of the Sleep Disorder Center at Mount Sinai Miami Beach. Well, first of all, it's a unique field, right? So particularly when I got into it around 1988, when I became more full-time involved in sleep medicine, there was not a lot of us. My certificate was in the 350s. And I remember when the certificate for being a sleep doctor was called the Certified Clinical Polysomnographer, which has nothing to do with really clinical practice. It was just about interpreting a test. And then it evolved, of course, into a more formal board certification. But when I first got involved in it, it was a nascent field, and my entry into it was through an interest in control of breathing and non-invasive ventilation. From there, it was how do you measure non-invasive ventilation, or how do you measure ventilation? And of course, with Marvin Sackner, who is a genius at this sort of clinical applications of devices he developed, calibrated respiratory inductive plethysmography. He was using that during the day to measure breathing patterns in patients with COPD, ILD, and in normals, extrapolated that to night, built the sleep laboratory at Mount Sinai in the 1970s. I think it was the 7th accredited sleep disorders facility in the country, and then developed the fellowship training program. And I just happened to come in at the right time where there was a need and given an opportunity to succeed. And it was really terrific to grow up in that era. It was a little bit of the Wild Wild West, but it was the Wild Wild West with a direction. And the direction was to improve clinical outcomes, to develop standards, and to develop a more basic understanding of the role of sleep in health and in disease. That was kind of by default, right? So here I am, I'm a freshly minted pulmonary critical care specialist with an interest in control of breathing. I'm given an opportunity to run a sleep disorder center, and I have to learn sleep. So where do you go to learn sleep? Well, you go to the societies and you go to the meetings. So Southern Sleep Society, I started attending that. Started coming to, back then it was APSS meeting and not the sleep meeting. Started attending committees and trying to participate in committees within the association. And I was fortunate enough to be given those opportunities. One of the inroads, and one of the unique inroads, I think, for many of us who participate within the society, is that I was first tapped, I think, because I'm fluent in Spanish. And they wanted to do something particularly to expand the reach of the organization to the Hispanic population throughout the United States and maybe even beyond. I don't know what the actual underpinnings of the desires were, but I know that I was asked to translate a lot of things. So I think that the translating ability of my language abilities were tapped for that reason. And that sort of started me off. So from translating papers, had opportunities to then join other committees and to be more influential and to be recognized. Well, my career path was impacted greatly by joining the AASM, and particularly when I became involved in leadership. So I was not very well recognized at the time. The AASM committee structure gave me an opportunity to show my talents, my dedication, my intellect, and my passion. And over time, I was elevated through the ranks. That gave me a more broad representation across the country. People got to know me. And from then on, it just kind of snowballed. And before I knew it, I was involved in higher and higher levels of leadership within the organization. And once you're in the organization and in the committee structure, you meet some really great, smart people. And if you are lucky enough to befriend some of them and to be able to showcase your talents in a way that they are recognized as valuable, they will elevate you. And in this particular association, it isn't, and I believe even today it is not that difficult to showcase your talents. I think we're very receptive to taking people from all sorts of disciplines who are talented, intellectually quick, thoughtful, and molding them and using those talents and then letting them show us what they can do. And if we're like-minded, raising them up through the ranks and allowing them to succeed. But for me, without the AASM, I don't think I would have gotten anywhere near to where I am today in my career. You know, the major issues that affect sleep medicine today are fundamentally similar to those that affected it when I became a part of the leadership. Even when I joined the organization, they've just taken a slightly different perspective. So now we're talking a lot about artificial intelligence, and that's how we're going to change things. When I was involved in leadership, it was how is home sleep apnea test going to change the field? When I became involved in the field is how are changing standards going to modify the practice of sleep medicine? So I don't think that the questions are very different fundamentally. So for me, it's always been about what is it that the country needs? What is it that my patients need? And how can this organization help my patients and the practice of sleep medicine grow? So early on, it was about education, education for politicians, educations for patients, educations for the lay public about what is sleep medicine, what do we do, how are we different? And then it was about promoting the field of sleep medicine. Why is sleep certification important? What are we going to do with it? Why should you see a sleep specialist? Then it translates into why should you be seen in an accredited sleep disorder center? What's the value of accreditation? What does that bring to the table? How does that change outcomes and provide for better care for patients? And then finally, it was about getting the country to recognize and the entire field of medicine to recognize that sleep medicine was unique. It was a discipline in and of itself. Even something as routine as understanding that obstructive sleep apnea is a disease is something that happened within my time within the field. And I remember when it happened, that when I was, at that time, I was the alternate delegate from the American Academy of Sleep Medicine to the AMA House of Delegates. And I remember when that went through and how hard we fought to get that to go through. And you would think that would be a natural thing, but no, all these things require time. It's an evolutionary process. And I was given the opportunity to participate in that, and I've always been very grateful for that. I think it really changed how I think about medicine, how I think about making medicine better for our patients as well as for our country. Well, I've been now attending AMA meetings for over 2 decades. I've attended the APSS and now sleep meetings for a little over 3 decades. So I have a pretty vast experience with both of the groups. With the AMA, we are really, I like to say I'm a beat cop, right? I'm there to serve and protect. I'm there to serve the academy, and I'm there to protect our field from incursions from well-meaning but ill-informed other physicians and other scientists. So when resolutions come up that might affect some field of sleep, like with hypnotics or circadian rhythms, and those resolutions are contrary to the way that our science tells us we should be sleeping, then my job and the others who attend the AMA with me, our job is to go in there and to explain why that resolution is at fault and to try to modify the language so that it is consistent with what we know to be true scientifically. Well, when I was on the board, the ACGME sleep exam transition had pretty much occurred. I was on the tail end of it. In fact, when I was at the highest level of leadership in the association was the year that the first ACGME board examination came out. So of course I had to take it because I was president at the time, and it would be unwise and I think unpopular if the president of the academy did not take the new examination. So even though I was in perpetuity certified by the American Board of Sleep Medicine, I went ahead, studied, took the exam, and thank God I passed. Well, the AASM has accomplished a number of things that are of incredible importance and value. First of all, they established the field. I mean, let's start with that, right? So there's no field of sleep medicine. There's a group of physicians and scientists who are interested, some in how the brain works, others in how breathing during sleep works, and still others why we're moving in peculiar ways when we sleep. And we all have to come together as a field. So think about this. You have to take people from psychiatry, respiratory physiology, and pulmonary, neurology, and assorted other fields and bring them all together and create a new field. So how does one even do that? Where was the blueprint for that? So I don't think that that was a trivial task. I think it took a lot of vision, a lot of guts, and a lot of years. But those, those changes occur because we had some really brilliant people at the top. And it's not just Bill Dement and the group from Stanford. There's also a number of people throughout the country who were involved. I still remember the work that John Shepard did to kind of steer the society in certain ways to help us become more mainstream. Stuart Quam has been very influential. So it's not one person, it's just an evolutionary process of just brilliant minds, all with a common goal, which is to create a field of sleep medicine that is valuable to patients, that shapes science in a way that it can be used to promote public health as well as to promote personal health. Well, AASM leaders can affect one in a number of different ways, right? You have the people that you look up to that you're never going to reach, right? Maybe because of age or for geographic separation, et cetera. So while I've met Bill Dement a number of times, I never felt that I was particularly close to Bill Dement or he close to me. But so I think if I had to say what leaders in the field have been closest to me over my career, one would be Larry Epstein. Pat Strollo has been very close to me, particularly in the years after my time on the board of the American Academy of Sleep Medicine, because he and I have been serving for years now as delegates to the American Medical Association. I think Stuart Quam was of great influence to me because Stuart and I, when I first became involved more closely with the Academy, Stuart took me on accreditation site visits, and I got to talk to him and pick his brain a little bit, and I thought I learned a different concept of what the society might be like based on our conversations. I thought Andrew Chesson starting the standards of practice and promoting that was an extremely important part of what we have become. And there are numerous others. You know, when I sat on the board, there were many individuals who didn't make it to the highest levels of leadership who I thought were very influential, like Rick Barry. You know, Richard has been an incredible asset to the field of sleep medicine, and I consider him to be one of the individuals who influenced me very strongly. And then there's, you know, there are so many people involved within the Academy that, you know, it's difficult to signal out one. I think if I had to go back and say who was the single most, or who was the first person that got me interested in it, it was probably Martin Cohn. You know, he was the one who said, Alex, if you're going to do this sleep medicine thing, you've got to become part of the Academy, you've got to participate, and that's how you're going to grow in this field. Now, most of them are not for public consumption, at least not the good ones. Most of them, or many of them, deal with Jerry Barrett and his unique approach to management and to people. But I think those are better left unsaid. Well, I don't think that people understand how much thought goes into the decisions that the Academy makes. I believe that in the population, even within our own members, there's this sense that decisions are made quickly. You know, we take a lot of time and a lot of thought to plan things out. And I believe that members have to understand that while we would like to be able to predict what's going to happen in 10 years, it's very difficult to do so. And so we try to limit our decisions to things that can happen this year, next year, and the next 4 or 5. That's why we have 5-year strategic plans. And even within those 5-year strategic plans, things can get derailed. I mean, in our 5-year strategic plans, when I was on the board, we didn't expect home sleep apnea testing to necessarily become part and parcel of our armamentarium to diagnose obstructive sleep apnea, but it did. So at that moment, we had to react, and we had to react in a way that was, you know, intelligent, appropriate, and comforting to our members. So I think that our members need to understand that what happens in those boardrooms is thoughtful. It's meant to improve the field. It's meant to advance the specialist in sleep medicine. And it's not just meant to advance the Academy as a unit, but it's meant to advance the field as a whole. Oh, the AASM is my friend.